For Wall Street Media, I'm Mike, I'm here with Doug, and we'll help you make money in the stock market with information you can't find anywhere else.
What do you have for us, my friend?
We have news highlights. We have a video of the Roth conference.
Oh, super cool. Orthovita, I like those guys.
Absolutely.
From Pennsylvania?
They are?
Yes.
For anyone that's interested, you can go to wsw.com/webcast/Roth20 to follow to listen to the full presentation. And also you can view the slides there. The video is from Tony Koblish, President and CEO of Orthovita, ticker VITA. He talks about the company's newest product, Cortos, and their hopes to file with the FDA towards the end of March. Let's take a look.
Turning our attention to the next product opportunity, which we believe is our home run opportunity, Cortos bone augmentation material. So Cortos, like nothing else, this is a material, a product that's been developed specifically for vertebral compression fractures. It's a two-part paste system. It's not a powder and a liquid mix like polymethyl methacrylate bone cement. You basically pull the trigger of the gun, it mixes automatically in the mix tip, and you can start and stop as many times as you'd like. It's got our proprietary bioactive glass ceramic in it, so bone likes to grow onto in apposition of the material, and it's designed specifically to treat compression fractures of the spine. It's not adapted. And that's the first clinical indication that we're going after in the U.S. However, there is tremendous opportunity for this product outside of compression fractures of the spine, and we've learned that through our European experience. We've augmented screws of nearly every type in the body in osteoporosis. So what I think we have here is a fracture fixation material that is very adept at treating acute cases of osteoporosis, particularly fractures, or acute cases of providing fixation for screws that are being placed in osteoporotic bone. We've also had some tremendous experience outside the U.S. in cranial defects. However, these will all require expansion of the label. The first opportunity and the foremost opportunity is in compression fractures of the spine, and that's where we are focusing our efforts from a regulatory perspective and from a future commercialization perspective. So taking a look at the work that has gone into the clinical data set to support Cortos. In the middle, the pivotal phase trial consists of about 256 patients in a 2-to-1 randomization scheme, 162 Cortos versus 94 PMMA patients. All of those patients have been followed out to 2 years, and the follow-up rate has been exceptional in 78 to 80-year-olds, which is a tremendous result and speaks to the rigor of the study, and I'll discuss that a little bit more in detail in a moment. Our commercial experience in Europe has resulted in about 12,000 implantations in Europe, so we feel confident that we have experience with this product in both the controlled setting of a commercial clinical trial and the less controlled setting of a commercial rollout. And thus far, the product has proven to be robust, safe, and effective, we believe. We've also submitted significant amount of adjunct clinical data from clinical sites ranging from U.S. pilot phase, European CE mark clinical studies, and several registries from Italy, Sweden, and the UK to total about 527 Cortos patients filed in our latest clinical filing, regulatory filing with FDA, for a total of about 621 patients to be looked at in compression fractures. This very well may be the largest set and most rigorous set of VCF clinical data ever assembled. So from a timing perspective, we're right on schedule as per guidance the last couple of times I've commented on this. We've enrolled the entire study. The entire 2-year data set has been followed up, and the data is in-house as of the end of January. This puts us on track to process the data, write up the clinical report, and put the final 2-year data set together for filing with FDA by the end of March, latest the first week in April. And so after that is filed, that'll drive a 90-day review from FDA.
I like these guys. You know, I'm bearish on the market. I'm bearish on the future, right?
You still are?
I am. But I think that for biotechs, healthcare companies like this, when they've got a new product, I think these are the companies that you should be looking at.
Okay.
Now. Absolutely.
But overall, you're not bearish on the market. You wouldn't...
Overall, on the market, I don't like the market. Okay. But I think there are going to be a lot of home runs made this year with companies like Orthovita and biotechs and healthcare companies that have something interesting and new coming down the pipe.
And that will make them stand out even more in this
Absolutely.
kind of
Well, everybody else is plunging. These guys get their new product approved, right? Whew, here comes some sales.
Great. A couple of notes. James Francola, EVP of Strategy of Ariba, ticker ARBA, expects 26 to 30% growth in the sub-software business this year. Tony Young, CIO of Informatica, ticker INFA, spoke about their intention to acquire Applimation to expand their market. Jim Hawkins, President and CEO of Natus Medical, ticker BABY. Well, yeah, I saw you looking over.
I'm keeping an eye on you.
Talked about the 90% market share in the US and said that in 2009 they should get about $9 per test compared to $8.40 in 2008.
Which is a nice, healthy increase. Another healthcare company. I like this.
Mm-hmm. Joe Chiani, Chairman and CEO of Massimo, ticker MASI, delivered news from a London ambulance service pre-hospital study specifically mentioning Massimo's device RAD57 as an improved CO2 detection device. Robert Mills, President and CEO of Columbia Laboratories, ticker CBRX, spoke about the company's pregnant study, which looks to prevent preterm birth in women with short cervical length. Robert Sporns, CEO of HQ Sustainable Maritime Industries, ticker HQS, spoke about a new feed mill opening the first quarter of 2009 and new processing plant in 2010. George Klaus, CEO of Epicor Software Corporation, ticker EPIC, explained that with the launch of Epicor 9, they achieved $500 million in shares last year.
Okay. I would like to just, those are fine ones, and Orthovita I think is very exciting, and I think you should listen to the whole presentation. Go to the webcast site.
Again, it's at wsw.com/webcast/ROS20.
And you should also listen to Todd Sullivan on StockTwits. Today, UGL, which he talked about 1 week ago, and which we brought to you on the show here, was at $35 a share at last trade, $39 a share.
Nice.
It's $4 a share, and he called it.
Nice.
I'm going to be putting a lot of these up there later today.
As opposed to the Dow in the last couple of days, right?
Absolutely.
I mean, that's amazing.
Yeah. $4 a share up versus
5% down.
But I think companies like Orthovita are going to be, just as you said, Mike, much more notable this year because they get these approvals and they are going to skyrocket while everybody else, at best, everybody else is flat, right? Or if not falling through the floor.
Yeah. Perfect. And Roth is picking them out for you.
Roth are great at this. I've gotten many, if you guys haven't been watching the show, and you should, I've gotten many great ideas from Roth. Roth are great small cap stock pickers. And you want to listen to the whole presentation, look at the slides, right? But they are fabulous at this.
Perfect. We're here every day at Wall Street Media. You can find us directly at wsmco.com. Thanks.